I'd like to thank everyone for taking the time to attend our presentation, How to Get a Handle on Your Patient Identity Challenges. Our speaker today is Michelle Schneider. Michelle is a solutions engineer with Iatrix Systems, focusing on the interoperability needs of hospitals, networks, regions, and states. Michelle has participated in EMR implementations and conversions, HISP and HIE implementations, EMPI management, and interface management and testing. She is a registered nurse committed to the mission of educating the healthcare community about interoperability as a means to improve patient outcomes. And now I will turn it over to Michelle to get us started.
Great, thank you, Amanda. And as Amanda said, my name is Michelle Schneider. I do see some names I recognize on the attendee list, so it's great to talk to you all again. And I will be moving through. I hope you will ask questions. Please put them in that chat section. I love to hear your questions and respond to those, get some conversations going throughout the presentation. So please don't hesitate to put your questions out there, even comments, lessons learned, things you want to share. I welcome that. So please actively participate. So our agenda today, we're going to talk a little bit about patient identity first, just really thinking about the definition of that on its own. And then we're going to get into the EMPI and talk about what it really is. And then where do we begin when we understand EMPIs and what we need to do, that we need to do something, knowing where to begin. That's our next step. And then we'll talk about managing that. And then we'll just close with some options of how Iatrix Systems might be able to assist you in managing your EMPI needs. So as we get into patient identity, we really are asking, who is a patient and are we sure? So that sounds very silly, but it really is the fundamental information that we need when that patient presents. So a patient is someone who's receiving or registered to receive medical treatment from our hospital or our network or from somebody in our HIE. So the patient is also someone who we're sure they are who they say they are, right? They have an ID card with a social security number, for instance, a driver's license, a credit card, anything like that. And some of us might be using some of those other methods out there, like, you know, the Equifax, Experian, TransUnion, etc. So those are all things when that patient comes into our little bubble in the world, perhaps it's a hospital or a skilled facility, a rehab facility, a lab, outpatient lab, anything like that, we are doing what we can to make sure that in our little bubble we know who this person is. And it's normally not the process of an EMPI to identify a specific person through additional means or checks. The EMPI, as we're going to learn and talk about, is collecting information from other sources, and we're going to put all of that together. So when we're talking about a patient across a delivery network, we're really thinking about a single system. And as I said, they've gone through everything possible, as long as that previous slide is true, to make sure we understand and know who that person is. But patients don't always stay in our little bubble, right? We can't always control that. So the patient is sent elsewhere for lab work. They might go to a Quest lab, a core lab, some mom and pop lab somewhere for additional work. They'll get a consult somewhere, or maybe go to an urgent care. And the delivery network, so you might be part of an HIE or your network of multiple hospitals, anything like that. Now suddenly that information is segregated and it's at risk. Our single patient identity that we had in our little bubble is now at risk. So this is where the trouble can occur, and EMPIs can help, and I've seen it happen, and it really is exciting when you start to see that value. And that's as long as we don't ignore it, right? We have this cute little guy with his fingers in his ears, and some of us may have a little person in our lives who has that very look on his or her face occasionally. Not as cute then, right? And so we're going to talk about EMPIs and how they can help. You got to pull those fingers out of your ears, though. So when we get to the EMPI, we're talking about a situation where we have multiple instances of the same, we wish it were all the same, right? The same demographic information or similar demographic information on a patient. But these sources are scattered. So it's coming in from different registration systems, clinical systems, anything like that. And the way that we can remedy that situation is to have software in place that has algorithms. So an algorithm is just a bunch of rules, really, right? Some of us took those advanced math classes and dealt with algorithms, and in our world of EMPIs, it's really just using some advanced rules that help us determine if someone is the same as another entity or life or person, or however your group terms those. So we take some of those matching and non-matching characteristics and we run them through our rules or our algorithm to decide, is this the same person? So we need to have processes in place that will manage that workflow and remediation as well. So sometimes even the best algorithm, if you have two people who are just so close, and I've seen it with twins, multiple births, it is really difficult to have that algorithm perfect so that it will serve the masses as best possible. So you need reporting and checks and balances in place, and it takes diligence, but it is worth the effort, absolutely. So we're going to talk about some of our terminology, and some of the things you'll hear people talk about when you're talking about EMPIs is deterministic matching and probabilistic matching. And those are, kind of, those words can be seen as kind of vague, but where deterministic is really expecting an exact match. So if I say my name is Michelle Schneider, then I have two L's and my Schneider is not Snyder, it's Schneider, and I've seen it messed up in a lot of places, then I will not match, because if you only have one L for Michelle, for instance, instead of the two, a deterministic matching environment is taking that and saying that's not a match. So a large HIE would outgrow this quickly, or it actually would have a very difficult time taking off in a setting without an EMPI that is going to be a little more mature and complex. So you would end up with so many unmatched records, duplicates out there, that it would just lose its value for your providers, your patients, and all the clinicians who rely on it. So then we get to probabilistic matching. So probabilistic, the root word there, probably, it's probably true. It's probably a match. We're going to take some leaps here, and we're going to have nicknames where Jonathan might have a nickname of John, and we're going to say those are probably the same, okay? And take those and build those rules so that we can make those very close and apply weights or values when we see those probable matches. Okay, so by associating those algorithms, we get the scores, and we decide how high does that score have to be for me to make those two match. And we're going to get into that a little bit more. You didn't know that you were going to have to know math today, but a little bit of math. We'll put on your thinking caps, and we're going to talk about this a little bit deeper as we go here. So I have an example, and we're going to go through these lines. So we have EMR1 and EMR2 columns. So EMR1 sends in John Smith, John, Smith with an I, middle initial of R, and look at that address, 110 South, spelled out, Main, spelled out, Street, we just have ST period. Okay, this person lives in South Windsor, all spelled out, CT 06074 with a date of birth of 1990, 0808. Okay, now EMR number 2 sends in the same person, only spells John, Jon, with Smith being with a Y and an E at the end. The middle initial is the same, but look at that address. We have S period for South, and we spelled out the word street. South Windsor has S period as the South, and then the rest matches. So if we look at our deterministic and probabilistic columns, you can see that deterministic would say Nope, not a match. And depending on how our algorithms are set up, if we allowed John and John with those two spellings to be a match, if we caught street, the full word, and street, ST period, and said, when you see those two, they mean the same thing. So that's what your rules are doing. So you can see that in a probabilistic setting, it could in fact match those two and say, yes, they are the same. We've saved ourselves a whole lot of trouble with these algorithms because now we don't have two separate persons, two separate lives, as some HIEs will call it, and we know that that one record is going to be seen by all clinicians, by the patient when they go to the HIE, when they go to the patient portal. All of the information will be there from both EMRs. Nothing will be missing. You have decision support. You've got a full record for your customers, your providers, your clinicians, your patients. Okay. So now we're going to talk about false positive and false negative. You'll hear those terms mentioned a lot when you talk about EMPIs. And a false positive is just that. It was matched as positive, but it's not. So a match between two records that do not represent the same person. That comes back to our twins. That's my, the biggest nightmare of anybody who manages an EMPI are twins. I had a situation once where I was dealing with trying to say, how could we have an algorithm that said Brendan and Brandon, who were twins, and everything else the same. When you're little, you live in the same house, your address is the same, your birthday is the same, everything. So we needed a way to make sure that Brendan and Brandon stayed as unique, separate individuals. So a false negative is just that. It's been like if our John and John or Smith and Smith, those are pretty different. The Smith with an I and the Y and the E on the other one, those two are pretty different. So not all algorithms will give those a good calculation, a high calculation. So they might be a false negative, meaning the match result failed when they really are the same person. Okay? So in this example, you can see what algorithms do. These EMPIs take different pieces of the patient's demographics and they apply weights to them. Okay, so we have a first name. If it matches exactly, Michelle with two L's in both places is going to receive a score of 8. If it's a partial match, meaning Michelle with one L and Michelle with two L's, it's going to get a 5. Okay, and then completely different, we're not going to give the score anything, and missing, we're not going to give it anything. Now you'll notice that we also can do minus or subtract from the full score. So if the first name's perfect, but the last name on one is different from the other, completely different, we're going to subtract 4. If it's missing, we're going to subtract 3. If it's a partial match, and maybe we did set up a nickname for Schneider and Snyder, we might give it 10 rather than 15. Okay, so as we move through here, you can see middle, gender, address, and you can see social security number when that is not a match, minus 10 when they're totally different. Okay, so this is something that takes a lot of time. We'll talk about implementing an EMPI a little bit. This is where a lot of the implementation efforts come in, is really getting that algorithm correct, not only for your population by their demographics, but also we think about ethnic background. So I worked in one area where we had a very large Hispanic population. We had thousands and thousands of people with the last name of Gonzalez. There were just so many of them. And so we couldn't give that the same weight because there were so many, it would have really thrown off the calculation. So taking into account different areas, different ethnic groups, what are common names that you see, and really making this a very complex set of rules that fit your needs in your hospital or healthcare system. Okay, so it really is exciting. I love a good puzzle. So that's pretty much what this is. It's a great puzzle, a great way to talk through that. So this particular one where we're talking about the false positives and false negatives, you can see In the false positive example, it said, yes, these two are the same. You'll notice I've highlighted in green the things that are different. This happens quite often where you have two people who are in a skilled nursing facility. And this one is close to me as well because I spent quite a bit of time working on our extended care facilities in the health system I worked in order to make sure that when it was that address, the same as the nursing home, it would not count as much. So we really spent a lot of time tweaking that because we have John and Gregory here. They both have the last name of Smith. Their dates of birth are quite close. The month and day are the same, even though the years are 2 years apart. And the social is completely different. And even then, because of the other things that matched, it came out very high, and it was a match. So that is a false positive. And then in the false negative column, you can see that because of the differences in the address, because of the missing middle initial, because even the date of birth is the same for these guys. So that added a lot, even though the socials are different. So it was a false negative. In this case, it only got a 44 because somebody entered in a social incorrectly. I have seen that happen quite a lot as well. You would be surprised how often that happens, and where somebody might fat finger an entry of a social. And so that has really caused a lot of trouble, and there are a lot of great reports and things like that with the EMPIs that can give you hints like, hey, you might want to look at this one. It was very close. So what I would do is spend quite a bit of time each day. I would come in the morning, and probably my first hour every day, I ran the reports of things that were close to our matching weight. And I would just look at those. And I scanned them. I would research a couple, send some emails. Hey, check this one out. I would ask HIM if they knew or call a doctor's office. There is some TLC, some care and feeding that needs to happen in managing an EMPI, but it is worth the time. It really is. So don't be afraid. This is a very colorful slide, but it is meant to really talk about the best practice workflow. Okay, so we have information that's sent from 3 facilities. We have the orange facility, the blue facility, and the purple facility. And they are all for the same patient. So the first one, facility ABC, we have James Sir Brown. And the second one, we have Jim Brown. And the third one, we have James Brown. So the second and third, the blue and purple, do not have a middle initial. So what happens in an EMPI is that orange one is first. That one comes in. And then the blue facility sends something in. Okay, and those two are found to be a match. They have enough matching information that they are matched. But then we always are going to update. The last one in wins. So then the purple one comes in. And that one has additional information and has matched to the blue and the orange. So you can see the final best record is that last line where we have the EMPI number with James. Sir was the last middle name that came through. Nothing trumped that. We want to speak in card terms. Nothing trumped that, so Sir is going to be the final middle name. The purple section was the last one in, so we're going to take everything from that one that has not been trumped, or you can see the phone number was maintained from the blue because this purple entry, the purple hospital, didn't send a phone number. So we're going to keep that. So this last line is the best possible record. Okay? And so we aggregate that data, and now we can use it for other purposes as the best record for this patient. So we've got the analytics, population health, all those downstream required systems. We can use that best possible record from the EMPI to provide as much information as possible. Okay. So now I'm going to dive into some benefits of an EMPI for your workflow. And I've talked about some of these as we've moved along, but removing duplicates from existing systems, that is first and foremost. That's what we're going to do. The first time you dive in with this EMPI and you pull in those multiple sources, you can automate a lot of that by setting up your algorithms to be correct. You can eliminate so many of those duplicate charts really out of the gate. That's kind of the fun first honeymoon phase of the EMPI, where you get in there and you've removed a lot of those. Okay, so you combine those, and that helps HIM, and of course helps registration. They don't have two records to say, I don't know which one is the correct one, and so they have to just make the choice. Next, it assists in billing, and it gets the correct insurance information. That last record in, last one in wins. So now if you're in hospital A and you have a bill that has been out there for a while, now the patient has updated an address, updated an insurance, anything like that. Now you've got that updated information. So you can, even if it came from another source, the last one in wins. So now you've got that information, and when there's multiple MRN numbers, you know that it's going to pull it into one. Accounting is now a little more streamlined. You also get a truer picture of the patient for your providers. I touched on that a moment ago, where the provider is going to have better decision support. If they're missing a whole chunk of information because there were duplicates in the system and they just pull up one that they think is everything and it isn't, then they're missing out potentially on some important information. It could be an allergy that was developed. It could be anything like that. So, you know, you've got a lot of opportunity here to provide your providers with what they need. It also gives you the ability to aggregate data under multiple sources, so that for providers, CCDs, meaningful use, in the event of an HIE or a large network, think of having all of that detail to pull in, and think of meaningful use when you're putting in your numerator and your denominator. When you have 2 in the denominator instead of 1, it's going to make your percentage lower. So the more duplicates that you can remove and pull those together into one, your denominator is going to be lower, so your numerator will look better. Your percentage will be better, and if you're on the bubble, which I've worked with sites who've been on the bubble, and I was really trying to help them figure out how they could move through, we did find some duplicates. We were able to make that denominator fit a little better so that they were able to attest successfully. Of course, patients, and I've mentioned that as well. That patient portal, if I'm going in and I'm looking for my lab results, I'm like, it's never here. They said it would be here. It's not here. And you know, you get patients who are frustrated and they are not seeing what they're looking for. It could be because there was a duplicate out there, and the record associated with their portal was not matched because of some difference, some issue that did not allow that to match. And it simply decreases the cost of doing business. If you are a member of an HIE, then in most cases you are paying to be a part of that per patient life. So if you have 2 million lives, but you have 50,000 duplicates or 100,000 duplicates out there, then it's going to decrease the number of lives, decrease the cost of doing business, because you will have fewer, and it also just makes things a little more streamlined from a budgeting perspective to understand the number of patients that you are caring for. And then, of course, your analytics will be more accurate. That's an obvious benefit, of course, because the patient count is correct now, and so you're really good to go. All right. So now the problems, when we get in here, it really is kind of the flip side of the benefits. Okay, so I won't spend a ton of time on many of these, because really that we're looking at the benefits and now we're saying, well, what are the problems? if you don't have one. So disparate and incomplete clinical information on patients across the enterprise. We've talked about that during the benefits discussion. Billing duplications, incorrectly matching records within a facility or across the enterprise. So you might have mislabels due to an incorrect link. We're going to talk a little bit more about father-son, confusion due to junior-senior. I have that happen in my family, and you think about all the mail that they get that's incorrect. Well, the same thing is happening in a medical record. As we become more electronic, it's a bigger issue. And just confusion between individuals with similar or information from the same address. So we talked about that with the extended care facility. So you end up with, in a deterministic environment, it just can present a risk, because if you are only matching on an absolute exact match, we know that there are errors. We know that there are inconsistencies. So we need to take a look at that and see what kind of risk it presents for us. So now we've talked about those concerns and benefits, really the flip side of those. And so now just thinking about, where do we begin? Where do we take this from here? So we've got to really look at where the data is coming from. What's feeding our system? So certainly we have interfaces, and the ADT interfaces are usually where all those demographics come from. That's usually the main source and how we identify a patient. We have EMRs coming in, physician practices, the ancillary organizations, lab facilities, radiology, skilled nursing. Then we might also get flat files. We've worked with some sites that have just taken as part of a merge or affiliation another entity, and they've loaded all of those from a flat file just to start. Let's just start this way, and they throw those in. And there's not a lot of checking in those cases. Sometimes you kind of turn off the checks, the flags, because you don't want it to keep failing. So you want those to go in there, and that can cause some problems. And then we get into order messages, and some systems will allow you to create a patient from an order message, and the same is true for a CCD that you consume into your system. So if you've made those decisions, that does come with some risk. So understanding that and really watching that, auditing that, is an important component in making sure patient identity is correct. So asking yourself, have we converted from another EMR, and what do those old records look like? Do we have any records out there that are a problem? And then, are the MRNs formatted differently from those multiple sources? So getting samples of the data types and understanding the different data types that you have, comparing those from one source to another. So if you have 5 sources, you want a data type from each of those and understand the differences, because sometimes I've worked in an entity where there were messages from Epic, Allscripts, Centricity. We had a bunch of different groups sending, and their ADTs looked quite different because they could decide, well, we're not going to send that, or we have a rule that actually flips that around and makes it look a little different, or, you know, we strip the punctuation and this other one doesn't when the name has punctuation. So there are a lot of different rules that affected the success of that matching. So taking a look at that, understanding, are there rules in place that are colliding, and making it so that things do not match. So things like the Social Security number. When the Social Security number is unknown, we had one entity that used all 9s, another that used all 1s, another that used 0s, and then you just had the renegades who just made it up, and they would do 1, 2, 3, 4, 5, 6, 7, 8, 9, and they were just kind of doing their own thing because as part of their orientation, maybe they did not remember that, or it wasn't really reinforced. So those are some of the concerns that come up. And then, so that talks about the rules from those sources. So you want to get documentation. Is it documented? Is it part of the, the mentoring, the orientation, and understanding how do records get merged? So these single systems, each of those that are feeding your EMPI, your HIE, or your network, whatever it is, when a merge needs to happen, so you realize, oh crud, I created a second person by accident. What happens? Is there a documented process? Is it electronic? Is it manual? Do you have people who remove everything? I just did a blog post the other day where we talked about back in the 90s when I was part of a big implementation, the first EMR this hospital had ever had, and we had that happen, and we would just pull everything apart manually, recreate it. We pulled out charges, we removed documentation, and we would put it on the new one. I mean, it was really a laborious effort for quite a few people. And so now, maybe it's electronic, maybe it isn't, maybe some is, and there's other parts that aren't. So really understanding that, because that will result in quite a bit of effort. So I'd like to ask folks if they do electronically merge records. I'd like to understand from our group if you do electronically merge those. And I just have 4 answers here. Yes, you electronically merge. No, you do not. You do a mix, which is C, or you're unsure. You're not really sure what you do. And I'll just give you a moment to respond to that. All right. And why don't we go ahead and close that poll? I think you've had enough time. You didn't know there was going to be a test, right? And we have, let's see, 33% say yes, 33% do some of each, and 33% are unsure. So that's probably about standard, where there is a mix. And actually what I've seen lately is more of a shift toward some do and some don't. As we start getting more systems pulled together, so Meditech can do this electronically, and then there are other systems that can. Epic can do that electronically. There are others that, depending on the version you have, it will or it won't. So, and sometimes you don't know, that unsure group. Sometimes you're just not really sure what you've got going on. You know that there's some HIM angel who is managing those, and you're not really sure how that happens. So that's about standard. Okay. Now, it's important also that you know your duplicate rate. So potential duplicates, again, those are the ones that are close, but they're not quite there. And you really want to understand how often this happens. What is going on to cause that? So is it just simple name differences? Is it something that you can resolve with a little bit of education? Are there a lot of nickname problems where people are entering John? Maybe you can re-educate registrars and John versus Jonathan. You're seeing a lot of those. So really look at the data, try and draw some conclusions from that. And, are you missing information? Are there people who are leaving out middle names all the time? And the Social Security number, are they just always using 9s? They're not really pursuing that information. Baby boy, baby girl. This one is really, I couldn't believe the trouble that caused, because we had so many differences in how our different groups were entering baby boy, baby girl, and it ended up causing, you wouldn't think, I mean, to me it's baby space boy or baby space girl. We had people using underscores. We had people using upper and lower. We had people who didn't put a space at all. They just did baby boy, baby girl. And so it was amazing the number of mismatches that happened because of that as well. So when we're thinking about quick wins, what can we do today without implementing an EMPI? I can't do that by tomorrow, of course. So what can we do? What's out there that will allow us to maybe make a dent in this? And re-education of staff is really important, because you'll see some of those issues. And we really know, don't we? Like when you're working in there, you see these things. You kind of know the things that come up all the time. And you can look at that and say, okay, what can we do? So establishing a procedure, Social Security numbers. Right out of the gate, if you have a procedure for when a Social Security number is missing, we always use all 9s. Whatever, I'm making that up, but sometimes it's that it's missing, the patient doesn't give it. Sometimes the patient is not able and you're going to get it later. Maybe you use all 1s in one case and all 9s in the other, but you need to have a procedure in place so that you don't have the 1 through 9 person or something like that where people are like, I don't know, I'll just enter something, it won't let me go by in this software unless I enter something. Establish norms for baby naming. That's easy. For multiples, so baby girl 1, baby girl 2, multiples, if you can do that for your John Does. Those are all things that end up causing a lot of duplicates, and really those are things you could put some framework around pretty easily and educate people and hold them accountable. You can find that, you can run a report how many people came in with 1, 2, 3, 4, 5, 6, 7, 8, 9. And you can see who did that and hold people accountable in a way that you use it as education. It doesn't have to be punitive. It's just a way to make sure that the data is good. And educating your staff on how important they are. They don't understand the ripple effect of a typo or of not conforming, you know. So let them know the amount of work, and really it is a safety issue to some degree when you start pulling in things from 4 different sources. And another thing I had mentioned in the blog post was related to allergies, missing those, related to perhaps an incorrect match where somebody ends up looking like they have a problem that could hold them back from getting disability someday or something like that. I mean, these are big things that affect people's lives. So it's important work, and we want to strive for complete, accurate, consistent data across the system. So getting uniformity of demographics. How are you going to enter junior? Is it capital J, lowercase r, the same with a dot, capital J, capital R, the whole word junior? I mean, it doesn't matter as long as you pick something and stick with it and hold people accountable. Let them know you're looking. Let them know it's important, and hopefully that will help improve the EMPI interfaces, normalizing those. That's something you can do today. Look at those. How are those demographics coming in? Making sure that all the fields you expect are required. CCDs, how do you handle those when they come in from different sources? And think proactively. Are you looking toward new things? Are you going to start pulling in personal devices or some other type of source? You want to think about that. Make sure before you do it, it's fully tested, of course, and that you have a good plan for how that will be integrated into your system. So do you have an EMPI? If you do not, and you're just a single entity right now, then that's probably okay, and you may be able to get by with manually looking at that. But we've seen some big problems even in that situation. So considering an electronic MPI is really important. So as you add sources, you definitely are increasing your risk if you do not have an EMPI. If you do have one, but your duplicate rate is still very high, you've got a lot of false matches, then what you want to consider is analysis and remediation, because there are a few big players out there for the EMPIs. If you do have an EMPI, then it's possible that your algorithms are off. If things are wrong, you want to look at the data. You may need to simply adjust the algorithms. Look at that. In some cases, we worked with one site where their algorithms were really, they were not set up very robust at all. So we needed to assist them with that type of work. So your best practices will include a focus on those remediation efforts. So an auto link, and that's when using those algorithms, the system says, yep, these two are the same people, and you might have only that, but really that would be very difficult. That would be, you know, really rosy glasses on that you wouldn't need any remediation processing. So you want to have a method in place to look at each day. What does yesterday's look like? What did we do? What are those duplicates when we were looking at that earlier, those potential duplicates, the things that were close? And look at those and see if there were any that slipped through the cracks that should have matched or were matched inappropriately. So we want to clean up that EMPI and keep it clean. And you don't want to underestimate the staffing. I've told you a lot of things that I have done in my previous projects, and there's a big effort involved in cleaning up an EMPI and ongoing effort in keeping it clean. So educating those end users, that takes people, that takes human resources. Setting up policies and procedures, create them is one piece, but then you implement them and audit and give feedback, keep people accountable, doing that algorithm research, testing, tweaking as you need it, as you're doing this more and more and you're becoming more knowledgeable, or you add another source, you might need to look at those algorithms again. It might have changed the baseline population that you're serving, and so the needs might change. You're going to need people who reach out to the patients. They physically pick up a phone and call somebody and say, you know, were you here then? You know, sometimes it takes that level of care and feeding to do that. In many cases, I never called a patient, but I would call the source, might be a physician's office, and say, you know, Johnny came in, I have another record that looks very similar. I want to know if this same patient was here on such and such a day, and then we can match that. So they would do some of that legwork for me. And, you know, looking at those interfaces and modifying those as needed, testing those, really making sure that from each source it is the way you expect it to be, and then certainly merging and unmerging, especially since there's many of the smaller systems, the downstream systems, that do not electronically merge and unmerge. There's a lot of manual effort involved in that. So staffing for an EMPI should not be underestimated. You really want to look at that, and if you're all in, you want to make sure that you invest in those human resources as needed. So data governance across your enterprise is important as well. So who has the final say? So when you're looking at this and you're trying to decide the rules, the algorithms, the weights, the calculations, who does that? So you want to assign that to a group, and you need someone who is the final say. And the process and reporting. There's a lot of reports available out there with different systems so that you can see those close matches. You need a work list each day. These were all so close they go on a work list, and somebody's got to work those baby names, those junior seniors, the things that were close. And you want to understand the data and what each of those systems provide. So, for instance, two people might share a social security number. Let's take a look at those. Those are quick hits that you can usually decide pretty quickly. So some hospitals deal with situations where you have drug seekers at multiple locations. A person shows up at 3 different places looking for a narcotic. And any significant changes, reports like that. Show me anybody who had a first name change that is a significant change. So Michelle to Judy, that's significant. That's not just a little typo. So get a report of those and let me look at those. Those might be quick, easy wins. And you want to establish consistency. And that goes back to giving feedback, holding people accountable, making sure that they understand how important their role is in maintaining the value of the EMPI. So Iatrix Systems has a great deal of experience in this area, and as you're thinking about this, you're thinking about how do you begin, you're thinking about can you partner with somebody. We would love the opportunity to talk to you about our solutions. We do provide data analysis, and that is a free service in the beginning, the actual analysis of that, and then if you decide that you do want to move forward, then that's something that could be quoted work that we contract with you to perform. So that's something that you can easily kind of take steps toward. So the analysis itself will talk to you about pulling in all of that data, all of the records, and you would provide that to us. We would analyze that and get the number of duplicates for each source, figure the data quality, and we would provide you with a report of that so that you really had numbers, understood your duplicate rate. And then the remediation support as far as fixing it. I talked about the staffing, the number of human resources it takes, and it's not a small effort, but again, a worthwhile effort. We can help augment that staff to assist you in remediating the records, and then there could be some training involved so that long term you could do it yourself, or maybe that's something that you have a smaller bucket of hours monthly or something that goes toward helping keep that EMPI clean. So we provide consulting for EMPI and third-party integration. So if you need an engine, we have worked with these engines here you see on the screen, and also the EMPI specifically, if you would like assistance in implementing data remediation, algorithm, rules consulting, and just the analytics component. And then if you're migrating from one system to another and need assistance in that area, then we can assist you there as well. We have experienced team members who can provide that type of consulting. The EMPI analysis itself, as I said, is a free service, and then you can get into the comprehensive reports that get into the detail, and you can review the you can purchase additional information that will allow you to either remediate on your own or contract with us. So those are the services that we provide and can offer to you. Now, I have done a lot of talking, and I'm hoping that people have lots of questions and want to discuss their needs, what they've got going on, maybe some issues that you've come across. So I hope that you will enter those into the chat section of the meeting screen. So I'd like to open this up for any questions that you might have.
Okay.
So Amanda, if there were, oh, okay, go ahead.
You're fine. I was just going to remind everybody that if you do have a question, just enter it in the questions pane of your control panel, and I'll be glad to ask. And we do have one here right now. We're going to a new EMR in 2017. When should we start our EMPI cleanup project?
Okay, well, that is really might take a little bit of discussion, but depending on how many sources you're pulling in, I would ask that anybody going to an EMPI certainly would start right away looking at their own little bubble, because what we actually refer to it as clean data and dirty data, and you want to make sure there's only clean data going into your new system. So you want to do that analysis and make the opportunity for clean data as good as it can be, and that will be your best course to success. So you can start internally now, lower pressure, but then as you're getting, then what we would want to do, if we were involved in doing that, we would want to get information from all of those sources and put them through the analysis. And we could tell you what are your biggest issues. So we have a site we're working with now that is going live mid-year with a new system, and they want to understand how dirty is the data, and we're going to provide them with that information, and we can prioritize for them. You know, this is really your biggest problem. These socials are killing you, and addresses. You have so many different formats for your addresses that you really need to start focusing on that, start making that transition, get some consistency, because if it all goes into the EMPI, remember the last one wins. So even if we make that match for that person, you're still getting all those different things coming in, and they keep overlapping each other. So now is the time to start developing those standards, holding people to them, re-educating as needed, and then you'll be ready when it's time. And a few months before you want to do that analysis and see where you're at so that you can be prepared with clean data to put into your new system. I hope that answered your question. Any additional questions come up, Amanda?
Not at this time, Michelle.
Okay. I do want to mention before I turn it over to Amanda to close the webinar that if you were to request the slides, we do have, I'm not going through all of these, but we do have common terminology in here as well, so you'd be able to refresh your memory of what each of these means, getting into the terminology of EMPIs. And if we can help at all, we would love to. You can hopefully hear in my voice how passionate we are about EMPIs and how important they are, and to our, really our future of connected communities, integrated systems. So hopefully we'll have the opportunity to work with you. And thank you for your time. I'll turn it over to Amanda.